Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Acute phosphorus poisoning. Acute phosphorus poisoning. Here, the clinical features of acute phosphorus poisoning include the breath or vomitus or excreta becomes garlicky smell. Vomitus and excreta becomes luminescent, which is the diagnostic feature. This is called as smoky stool syndrome because the vomitus and excreta becomes luminescent. The patient develops hemorrhagic syndrome with hematemesis, hematuria, hemorrhage in the skin, mucous membranes, and the parenchyma of organs. Hepatotoxicity. In hepatotoxicity, the patient develops fetor hepaticus, flapping tremors of the hands, and thus the patient develops hepatic encephalopathy. Treatment of acute phosphorus poisoning. 0.2% copper sulfate solution is used as a lavage solution. 0.2% of copper sulfate is a chemical antidote. Gastric lavage is done with 1 is to 5000 potassium permanganate solution. This will convert the phosphorus to phosphoric acid and phosphates. This conversion of phosphorus to phosphoric acid and phosphates is harmless. Vitamin K 20 milligrams IV is used for hypoprothrombinemia. Post-mortem findings. Gastric contents contain garlicky odor and they are luminescent. And patient also, in the post-mortem findings, you will also find acute yellow atrophy. The liver is also seen. Chronic poison.
thank you and thank you for watching.